Good morning, everybody. I would like to give you an insight into the early childhood intervention program in Germany. So first, I would like to provide some information about the program's background, and this will be followed by a very short description of the federal program. And finally, I will show you where we are today. To do this, I will report some indicators of the program development. The commitment of the federal government in Germany started in 2006. At that time, the German public became aware of two main challenges concerning children in Germany. The first was that gaps in the child protection system became obvious. At that time, we had some very sad cases of child maltreatment. And the second challenge was that the public became aware that we had high prevalences of children showing mental health problems, like, for example, hyperactivity or even depression, eating disorders, and so on. And analysis showed that both increased risks of adversities in childhood and poor child health and development outcomes, they are both were statistically linked to psychosocial burdens in families. Psychosocial burdens like, for example, high parental stress, poverty, symptoms of parental mental health disorders, and others are closely associated with poor parental capabilities, and these poor parental capabilities might lead to children's poor health and developmental outcomes and to an increased risk of being maltreated as a child. And the early childhood intervention program in Germany tries to mitigate the influence of families' burdens on their parental capabilities. So the vision behind the early childhood intervention program in Germany is that all children shall have equal opportunities. This is in line with the WHO Nurturing Care Framework and is reflected in the administrative agreement between the federal government and the 16 federal Länder or federal states. And it says every child has a right to grow up healthy and safe. And we try to reach this by improving psychosocial care for families in need. Not every family, but especially families in need. So this is targeted support. And experts advocated that the strategy should be prevention-oriented and strictly voluntary, and participation of families should be strictly voluntary. So altogether, early childhood intervention in Germany is a preventative and voluntary part of the whole child protection system. It consists of three core elements. The first is building up cross-sectoral ECI networks all over Germany, nationwide. So we have about 550 municipalities in Germany, and for each municipality, at least one network coordinator should be funded. And the network coordinator should build up a local network, cross-sectoral network, and the members are health professionals, social service professionals, and others. And the second core element of the federal early childhood intervention program in Germany is voluntary targeted support. We have different support measures, but one very well-known and effective is the long-term home visiting services by healthcare professionals with additional qualifications. We call them family midwives or family nurses. And I'm very glad you, Professor Oles, will present one of these support services, the nurse-family partnership later. I'm looking forward to it. And the third core element are the so-called pilotage services in healthcare settings. You see the picture in the lower right-hand side. This represents such a pilotage service in a maternity clinic. And there, burdens of families can be early identified. Mother, in that case, a mother can be counseled, and if needed, they can be referred to an appropriate support service. So we had some initiatives of early childhood intervention in Germany before, but the commitment of the federal government started in 2006 with the implementation of the so-called action program by the Federal Ministry for Family Affairs. This action program consists mainly of 10 pilot projects located in all 16 federal states and the establishment of the National Center for Early Prevention. And the main task of the National Center was the evaluation of the 10 pilot projects. The results of the evaluation informed the design of the Federal Child Protection Act that is in force since 2012. And one part, the preventive part of the Federal Child Protection Act, is a federal initiative for early childhood intervention that developed to the federal foundation. This is where we are today, with a mandatory funding of 51 million a year. This is not so much, but it is added by additional resources from each federal state and many municipalities. And these funds are meant to build up networks, measures, and pilotage services in municipalities. And we have a very interesting funding architecture. The municipality, because it's a very decentralized country, Germany, each municipality designs networks, measures, and pilotage services according to local conditions and needs. And then they apply for funds, and this will be approved if the application meets certain quality criteria. And these quality criteria are informed by research results of the National Center. Okay. So, when we designed the federal program, we asked ourselves, what preconditions do we need to reach the goal to improve psychosocial care for families in need? And the first, what we need are the implementation of networks, measures, and pilotage services in municipalities nationwide. Then we needed a very strong and effective collaboration of the healthcare service and the child and youth service sectors. And this is because the use of child and youth service is highly stigmatized in Germany. So we need pilotage services in healthcare settings to make child and youth services available for families in need, especially for families in need. So this is very important for our program. The third important precondition is that families, yes, in fact, make use of early intervention measures, and not any families, but those families for whom these measures have been designed, families in need. Because we are here it is to make use of early childhood intervention measures is voluntary And therefore, it is very important for our program, for the working of our program, that the early intervention measures are positively assessed by the target group. Otherwise, they would leave the interventions. But it should not only be positively assessed, but the measures should also be effective with respect to an improvement of the situation of the family. So, and what we do is that if all these preconditions are fulfilled, we would conclude that the federal program might be successful. And I would like to give you an insight now into some indicators that help us to estimate in how far our program is successful, and that shows where we stand today. So the first is the nationwide implementation of networks, support measures, and pilotage services in municipalities. The action program started in 2006. In 2012, we see that 67% of all municipalities in Germany had already implemented cross-sectoral networks of early childhood intervention. And this proportion increased to 100% today, in 2020. The same picture, we have nearly the same picture with the long-term home visiting programs. We have nearly 100% of municipalities that implemented long-term home visiting programs. With the piloted services in maternity clinics, it started in 2006. In fact, there were these piloted service. This intervention was invented in 2006 in 2 maternity clinics. And in 2017, we have already 29% of all maternity clinics implemented piloted services. But however, further requirements were also indicated by municipalities. About 25% of all municipalities said that early childhood intervention networks needed to be further developed in their municipalities, and about 50% of municipalities said that home visiting support measures are not sufficient. Mainly, the main reason of this is that there's a lack of professionals, family midwives and family nurses in Germany. So what's about the effective collaboration of the healthcare sector and the youth service sectors? So there's changed a lot between 2013 until today. In 2013, we conducted a study with 28 practice-based pediatricians and 385 families of their children patients. And 31 families out of these 385 have been assessed as psychosocially burdened by pediatricians at that time in 2013, but only 1 out of 30 of these 31 was referred to local support services. And after we finished, when we saw these results, after we finished this study, we again asked the pediatricians, why did you hesitate to recommend early childhood intervention support services in your municipality? And what we found is that there was a lack of knowledge. There were doubts about families' benefit from use of ECI support services. And then pediatrician missed or anticipated that they didn't get any feedback. from the ECI support services, and many of the pediatricians admitted that they had difficulties to address non-medical issues. So in 2017, we conducted again a study and we had very different results. This mainly is because much happened between 2013 and 2017. First was that the proportion of psychosocially burdened families increased, mainly because of the high intake of migrants, especially refugees at that time. And second reason is that, of course, the Federal Foundation, Early Childhood Intervention, built up networks and measures nationwide, and we had some changes, legal changes at that time. So, and this is reflected in the results of our representative survey among 815 resident pediatricians in 2017, which provide a completely different picture. So at that time, 72% said that the proportion of families in need have increased, and 92% of pediatricians perceived the care for families in need as a challenge. And now in 2017, completely different than in 2013, 91% of the pediatricians knew about local early childhood intervention networks. 82 knew at least one local ECI measure, especially a family midwife or family nurse, and 37% took part in meetings of the local early childhood intervention network. And finally, at that time, 77% of all pediatricians said that early childhood intervention is a relief for their work as a pediatrician. And at that time, 1 out of 6 burdened families have been referred to appropriate social services or ECI services, and before it was 1 out of 31. So this is quite a good improvement. So in how far do families use early childhood intervention measures, and not any families, but families in need? This means, do we reach our target group? These are results of a survey with 8,000 parents with children from 0 to 3. And the upper line, and we also asked them whether they use measures, support measures, and the upper line represents the results concerning so-called universal support measures. This means these are support measures that are available for all families, independent of their burdens or needs. And what we see here in the upper line is that the lower the education of a family, the less likely is the use of these universal support measures. The lower line represents the results for early childhood intervention support measures. And what you see here it is the other way around. The lower the education, the more likely is it that this family would make use of an early childhood intervention support measure. So this means altogether that we reach our target group. On the other hand, if you see the lower left columns that represent the use of a family midwife service or a family nurse service, home visiting, long-term home visiting service. We ask ourselves whether the group differences, the difference between the educational groups, are pronounced enough. So we have to do much more effort. I think we have to do more effort in reaching our target group. Okay, and how far is early childhood intervention measure positively assessed by our target group? So these are, what you see here is the result, are the answers of to the question whether mothers who used family midwifery care were satisfied with them, and then here we see that 80% of mothers are very satisfied, and additional 15% are satisfied, and not surprising, nearly 100% would recommend this support to a friend. So these are very, very positive results.
Sorry to interrupt, you have 5 minutes left.
Yes, okay, this will work, thank you. Okay, but how far are these measures effective? And among the 10 pilot projects we had, I speak of before, there were 3 controlled trials of long-term home visiting services. We found their positive treatment effects, but only small positive treatment effects. And we had one special challenge, and these were the outcome variables. So we tried to develop together with professionals, with family midwives, family nurses, we tried to develop the so-called realistic outcome parameters, like that you see here. This is an interaction between the main caregiver and child, the care for the child, and acceptance of the parents of additional support is needed, and so on. And we tested this in an observational study, and we see that from the start of care to the end of care, all these competencies enhanced, and it was significant. The difference between this level of competencies between start of care and end of care is significant. So thank you very much. I think what we can see is that we are successful on each step. We had some successes, but of course there's a lot of work to be done in the future. So thank you for your attention.